Hi, Tim. Hi, everybody. Good afternoon, good morning, good evening, wherever you are. We are so excited to have you here today with us, and we're excited to continue our well-being series. And today we have an invited speaker, Maria Sobchenko, who is a doctor and who is going to talk on a very important topic about back posture and how we could take a better care of ourselves. Yes, because a lot of us spend many hours at desks, and I heard that a lot of us sometimes happen to have some back problems, right? We go to some specialists, we take some meds, right? Or we do exercise, yeah? Or sometimes we just over exercise. So all of these are interesting topics to explore. So, Maria, I will pass the word to you, and I hope that it will be something useful for all of us. Maria, you're on mute. Maria, you are on mute. I'm sorry. You're on mute.
And now?
Yeah, we can hear you.
Okay, I don't know what happened. So again, greetings to all listeners. So first of all, thank you that you spent this time with me with this lecture. I hope that you will get useful information, and I will do all the best that this lecture be interesting for you, not boring for you. I will try to avoid a lot of medical terms which may be difficult for you. So today we'll discuss a topic which is quite common to all of us. It's a back problem with our posture. So this is a prevention of this back problems. And let me present myself. As you heard, my name is Maria. I'm general practitioner and I am a rheumatologist. Usually then I tell that I'm a rheumatologist. Many people say, rheuma what? So rheumatologist is a doctor who work with inflamed joints, inflamed bones, some autoimmune disorder. So problem with back and some inflammatory back pain is also related to my specialization. So also we'll have a dive into the anatomy of the spine. I promise that I will touch just basic things regarding our anatomy, so it shouldn't be quite difficult for you. Also, I'll speak why our spine crunch, the most common cause of back problem. Also, we will touch two things which shouldn't be do when you have back pain, what to do, what are red flags for back pain, what is osteoporosis, maybe you heard this term, and of course about prevention of back problem. In the end of our lecture, we'll have Q&A session. So please, if you have some question while this lecture, just put on our chat or just ask in the end of our lecture. So let's go. Back pain is actually humanity's unique prize for walking upright. Course, we'll discuss about all the mammals. So they also have some joints problem. People who have a dog also know that dogs, especially pedigree dog, may have problem with their joints. But the human, they have especially their back problem regarding their lifestyle. Because of this upright walking, we have this problem. And let's discuss a few of them. Actually, the prevalence of back pain is quite high. And according to World Health Organization, it's like the most common complaint. And me as a doctor, I also approve that every day we have a person at our clinic that suffer from back pain. Not always it's older people about 50, 60 years old. It's also quite young person who suffer from some inflammatory kind of pain. We'll also discuss what is it inflammatory pain. And if to speak about future, we know that in future we'll have more people who have this complaint. So as I promised, we will dive into the anatomy. So let's start the anatomy of the spine. The spine consists of 34 vertebrae, and it's not like the flat structure. It's as shaped and curved column, and we have 7 cervical, 12 thoracic vertebra, 5 lumbar, and 5 sacral vertebra, and coccyx. So maybe you heard that the lower part of our vertebra fuse. That's why we have such a difference, 33, 34 vertebrae. To discuss the local anatomy, you know that we have small bones which calls vertebrae, and they consist from body and from arch. Here on this slide, you may see that we have this vertebra body. It's localized in the front and supporting part. Behind, we have the arch. It connects with the body. And you see here that the body and arch form the whole. The whole of all vertebrae form the spinal canal, and through this canal, we have our spinal cord. I hope that you know what is it. And spinal cord also has a lot of nerves. They go through these holes, and then we have some problem, then we have some compression, then we have some maybe formation in our spine. They compress these nerves, and that's why we may have some pain, some irritation, we may have some discomfort on our limbs, for example, on our hands or even on our legs. If we will dive deeper, we will find that we have such intervertebral discs. It's like pods. They have like amortization function of our spine, and it's localized between each vertebra. So between each of the vertebra, we have these pads, we have these discs. It consists of such rigid ring and a soft inner nuclear inside. It's like in the center. And you should know that the size of the disc is normally and perfectly corresponds to the side of this vertebra. It should be in normal. It's very important to understand this thing, because then we'll discuss some like disorder, some problem. I will touch just the most common problem of the spine. So we should find that then we have protrusion. It's like balding of the intervertebral disc. So you see here we have like normal disc, which like perfectly corresponds to the size of this body. And on this picture, and even on this as well, you see this balding. Then these components bald into the like outside. So usually this protrusion, they are asymptomatic. You may have no complaints at all. If at the moment we'll perform like MRI of the spine to all the listeners, I am sure that we will find protrusion in 98 maybe % of the audience. But it doesn't need like specific treatment. And disc protrusion is considered a part of normal disc aging process. It means that with age, all of us will have this process, but it doesn't need a treatment. So disc protrusion can spontaneously disappear, and also it may persist while whole our life. In some cases, we may have hernia. Hernia is a little bit different process, and it's more severe process. Hernia is a defect that when the inner content of this disc bulge into the canal and irritate the nerve. Do you remember a few slides earlier? I explained you then we have some balding. It may cause some irritation of our nerves, and we may have some discomfort and pain. So in a case, if we have this protrusion, we will not have any complaints. But in the case of hernia, then this defect irritate our nerve. You see here, It manifests as pain, numbness, and some muscle weakness. And as I said, it may radiate to the leg. It may cause some unpleasant sensation, and even shooting pain. And of course, this you should come to the doctor immediately because it will affect on your daily life. And very important that hernia cannot be pushed back into the spine. It's quite dangerous. Ukrainian people quite often refer to some manual therapist for this procedure. It's dangerous because in this way we may do worse. And hernias, as you see, it can be pushed back because it's quite a severe defect, and it should be treated sometimes even in a surgical way. Quite often I heard the question, why does the spine crunch? And why does the joints crunch at all? Sometimes it's like the major complaint of patients, especially young patients. Is it okay? How do you think? It's quite interesting if you relate this to some disorder or not. Usually I say like a joke that joints has a sparkling drink inside, because inside the capsule we have synovial fluid inside all the joints, and during movement the configuration of joints change and pressure inside also increase. And this synovial fluid has small gases. And then we move these gases in the synovial fluid, form small bubbles. And then they become larger and burst over time. So that's why we heard this sound. Also, with age, in the joints, we have some changes in the cartilages, and we may have thinner cartilages, and it may lead to some friction of the joint surface. So that's why we may hear the combination of different sounds, and we have this crunch effect. It's okay, and if you will have this crunching, if you have these sounds, it's normal, absolutely normal. But if you have this crunch with pain, with discomfort, it should be treated, and it's required to visit your doctor. So let's talk about main causes of back problem. I put here a few of them, and the most common are hypodynamia, long sitting position, lack of training, and incorrect position. Hypodynamia, it's a problem of 21st century, because all the people, the majority part of the people, they work at the office and they don't move enough. So our intervertebral disc, which we talked about few slides earlier, it doesn't have their own vessel. And the disc is fed by diffusion during movement. So it means that as much you move, more active you are, so the better diffusion, the better feed your disc. So if you will not move at all, if you will have a seat all the time, so your discs will suffer. They will not get enough nutrition. So that's why it's such important to have some actives, some physical activity. Long sitting position, the same. While sitting, all our metabolic processes in the spine, they decrease. Lack of training. And here I should add a very interesting thing regarding our muscle. Because our muscle, they may produce some protein, and they also produce such things that reduce the inflammation. So as much we move, as much we produce this protein, and less inflammation we have in our body. And of course, in correct position at the workplace. In correct position, it's not only our posture, it's also about some function. For example, if you have incorrect position, if you all the time have a seat like this, so you will have lack of movement on your lungs. You will have hypoxia because your lungs cannot move fully. You will have some discomfort and problem in your abdomen. Also, you may have some problem with blood circulation, and as a result, you will have some headache, you will have some vertigo, and etc. So other causes of back problem, they are related to your sleep. Sleep on a soft mattress and sleep on a flat surface. When we speak about soft mattress, so our body like drones, and the spine bends and all the muscles have to work all the night because your muscles should keep your spine. And the opposite, then you sleep on the flat surface, your back is not flat, as I said, it have some curves. And flat surface is not physiological for us. And then we have a sleep, for example, in floor. So our muscle, they are pressed and they also may suffer from impaired blood flow. So physical exercise with incorrect technique. For example, when you visit gym and you work by yourself without trainer, you may do some exercise in incorrect way and you may hurt your muscle, you may hurt your structures, and you may suffer from a back problem as well. Bad habits. Bad habits will be related to the a problem which connected with metabolic processes, because smoking, alcohol, and the same some chronic disease like diabetes, like rheumatoid arthritis, and even overweight, they're related to metabolic disorder and they decrease the metabolic processes on our joints, in our cartilages, in our vessel. So as a result, we'll have lack of nutrition, we will have the lack of diffusion which go to our discs. Let's discuss 5 no for back pain. What you should not do when you have back problem. First of all is self-treatment. You should not continue to perform exercise that increase your pain. Manual therapy that can lead to sad consequences. For example, then you have a back problem. As I said, that in Ukraine, unfortunately, many people like to visit the manual therapies, then they have the hernia. They try to push back this hernia into the spine, into the disc. So it's quite bad choice. So please, if you have some problem, if you have some back pain, you should not have self-treatment and you shouldn't ask for manual therapy until you will not define the problem. Warming up and hypothermia. It means that you like have some saunas, hot baths, or you apply some hot things or opposite cold things. You should avoid this the same until you didn't figure out what happened with your spine, with your back. Red flags for back pain. In general, red flags, it's the symptom which we should in the case of which we should ask for medical support as soon as possible. And if you find these red flags, if you find these symptoms in you, so please do not hesitate with medical support. You should visit a doctor immediately. So let's speak about them. First of all, it's pain at night and morning stiffness. Then you wake up, you feel the stiffness, you cannot move normal. You need maybe 1 hour or more to feel better. It's called stiffness. Pain that doesn't disappear at rest. Unreasonable weight loss. If you didn't keep any diet and you mentioned that your weight loss. Fever. History of fracture, especially if you didn't have some mechanical issues, if you didn't have some tremors, if you fall down like and or push your hands and you broke your hands, if you had a cough and you broke your vertebra or you broke your ribs, for example. So it's like a normal fracture. Fecal or urine incontinence. progressive weakness in lower limbs. That is said that you may have some numbness, irritation, or pain which goes into your lower limbs. Signs of inflammatory back pain. This is quite important for young people because inflammatory back pain is spread for this category of people. I guess you know this person on this slide. It's Dan Reynolds. It's a frontman of Imagine Dragon. Why he is here? Because this man suffered from inflammatory back pain and it calls spondyloarthritis. The way of his medical history took about 10 years. Quite long. He was treated with wrong doctors, with neurologists, with some herpetologist, until he finds the right doctor, and it was rheumatologist because Dan Reynolds had actually inflammatory back pain. What are the signs of this inflammatory back pain? I put it in our presentation because many young people have a signs of inflammatory back pain and they lose time and spend and treat with wrong doctors. So that's why I put here these symptoms. It's gradual beginning. If you had a sharp pain, it doesn't inflammatory back pain. Inflammatory back pain starts gradually. It's night pain, then you cannot sleep. Sometimes back pain make you wake up, and you may wake up with pain the same. Age below 45 years. Physical activity usually brings relief and you feel much better than you do some exercise. And then you go to bed, then you relax, then you rest. It doesn't bring relief. It just makes worse. So these signs are the most bright signs of inflammatory back pain. And if you find some of them, if you find one or two of them, please consult with your doctor. Another diagnosis, another definition which I would like to talk with you about is osteoporosis. Maybe you heard about this problem from your relatives, especially from your grandmothers or your grandfathers. Some of you heard from people who fall down and broke their leg. Usually if it's older people, the main cause of this fracture may be the osteoporosis. Here you see the picture of bone density. So on this picture, it's normal bone density. And on this picture, you see the osteoporotic vertebra. What happened? Then we have the osteoporosis. You see that we have more holes in this bone and it become more delicate. So if person fall down, it for sure will break this bone. In this case, do not. Why it happened? Osteoporosis actually is a little bit physiological process because all the people who are over 60 years, they has less and their bone density become lower. Also, people who have some disease who use glucocorticoid, it's hormones. Usually with glucocorticoid, we treat bronchial asthma or rheumatoid arthritis or other disease. If we use this medicine for a long period, so this medicine reduce the bone density. If the person had pathological fractures without severe mechanical effort, we also should think about osteoporosis. Women who have menopause, especially if it passes about 10 and more years in menopause, because estrogen, it's a hormone which keep our bone density in good level. Then we don't have a high level of estrogen. Usually it happens in menopause. So we lose this density and we also may have osteoporosis. If a person has some gastrointestinal or endocrine disease, then calcium and vitamin D doesn't go to the bones. and it causes osteoporosis as well. If you want, you may check your own risk if you will click and if you will scan this QR code on the slide. You may fill this questionnaire, it's in English, and you may check your own risk. If you're a young person, you don't have this, and you don't find you at this risk group, you may ask your relatives, you may ask your parents or grandparents to check their own risk. In a case, if you have high risk of osteoporosis, the examination, which called X-ray densitometry, is recommended. And also, I would mention the signs of osteoporosis. The most bright of them is appearance of hump. It's also called widow hump. Bone pain, fracture of bones or forearm resulting from minor injury, as I said, and frequent fractures, and decrease in growth by 3 centimeters and more. As I told that with age, we have some degenerative process in our disc, in that pads between vertebrae, and then become like thinner, sorry. So it's normal to us to become like to lose our height with age. So we decrease in growth with age, but it's okay to have like less than 3 centimeters. If we decrease in growth more than 3 centimeters, it's not okay. It's maybe the sign of osteoporosis. What to do if we have back pain? First of all, is physical rest. Please don't go to the gym, don't do some physical activity. Give you rest. Take painkiller. Painkiller which you may use and which may be safe, it's like ibuprofen, paracetamol, and diclofenac. If you have some chronic disease, if you have some problem with your kidney or with your liver, you should know what medicine you should not take. For example, if you have problem with your liver, you should not take paracetamol. If you have problems with your kidney, it's not a good idea to take ibuprofen. So if you have some chronic disease, so I guess you should know what medicine is okay, what medicine is not okay for you. Reduce the time spent in a sitting position, because in this position you have increased pressure on the spine. It's required to consult with your doctor if you don't have positive dynamic in 3 days. You may ask for medical help and for consultation with orthopedist, neurologist, or family doctor. It will depend on problem what you may have. If you have inflammatory back pain, as I described you regarding to Dan Reynolds symptom, so you should work with rheumatologist. And if you have red flag symptom, you should ask for medical help immediately. Correct sitting posture. Usually in this slide, all the listeners, they correct their posture at the moment. So let's talk about a few moments which are very important. I guess that most of you are working on the desk, and we need to control our posture all the time. So the main aspects are to support the posture with some moments like angles between our arms and between our knee and between knee joints and elbows. So pay attention that the angle should be here open, and the same here. If we have some sharp these angles, so it cause incorrect posture in the desk. Also support on the thigh and on the foot. You see that your foot should be on the floor. It shouldn't be like this way in this picture. They should be on the floor like in this way. It's great if their table and if your seat may be regulated up to your height. And please pay attention to the distance between the monitor and your eyes. It shouldn't be less than 40 centimeters. In the case, if you spend like whole day with your work with desk, it's recommended to do some breaks. For example, every hour you should make a break for a few minutes. If you are working in the office, you may have work upstairs or downstairs to your friends, to your colleagues, to have a coffee or to have some water. If you're using public transport, it's better to leave the transport in few stations before your spot to have a walk, because regarding and thanks to this physical activity you will support your health. And usually we have lack of physical activity then we are working in the office, and regarding and thanks to this small recommendation you may keep fit actually. Here you see the most common posture which we have in our daily life. Usually it's related to use of a cell phone and to use and work with a computer. Please control your posture, then you work with cell phone. You should not do like this way, you should stay straight. And pay attention how you lift the weight. If you lift the weight in this way, you will hold their pressure on your back and on your shoulders. You may have some complication regarding such lifting, and as a result you may have that hernias which we talked about a few slides before. And then you lift a weight in this way, so all the pressure goes to the knees, to the joints. They are like stronger than your shoulders, and in this way you will not have the complication like hernias or other things regarding to your spine. Here I would like to give you a few tips for the spine. So as I told you that we should stay active and we should keep about 8,000-10,000 steps per day. As I said, it's okay to leave the public transport in few stops before their spot to have a work. It's okay to have breaks at work every 60 minutes for a few minutes, to have some physical exercise, to go upstairs, to go downstairs, to visit your colleague, to have coffee, to have some cup of water. If it's possible, you should also perform regular cardio training. It may be swimming, it may be orbit track or Scandinavian walk. Our spine doesn't like to jump. Our spine doesn't like to run, because in this position, while this training, we may have some irritation and we may have some compression on our discs. So that's why swimming, orbit track, Scandinavian walk, Pilates, and other activities may be much better than running or jumping. It's better to have orthopedic mattress and pillow and orthopedic insoles, but if it's necessary. Who need orthopedic insoles? Usually it's people who had a flat foot. This disorder usually may be found in like childhood. If your doctor, if orthopedic somewhere told you that you have a flat foot, please pay attention that you should wear these insoles all the time, because if you will not, you may have some disorder with your joints, with knees and hips in older age. It's better to correct weight. I mean to correct weight distribution on your shoulders. The best thing for this is backpack, because if you will wear back on one side, it will cause some changes in the posture. Also, it will cause some muscle tension and muscle pain. Please correct posture behind the workplace, control of your body in the space. You may use some massages, balls, rollers, and myofascial release. I will give you a link to this on the next slide. Also pay attention how many water, how many liquid you take, and protein, fat, and carbohydrates, because all these things, it's micro and micronutrients which feed our discs, which feed our joints. And rejection of bad habits, because all these things, they increase the inflammatory processes and cause some disorders. Here on these slides, you have some exercises to relieve back pain. On this QR code, you may find the exercises in English, which may be useful for you. They may take just a few minutes per day, but they may relieve your back pain and maybe even to prevent some problem with your back pain. As I said, you may use some rollers. It calls myofascial release. Actually, you may buy these rollers by yourself and have them at home and perform these exercises on your office or on your apartment. And you even shouldn't visit gym to do them. And here I present you a short guide how to choose a pillow. It was quite unusual for me that we should choose a pillow up to some pose of our sleep which we prefer, and up to size of our shoulder. So regarding to the posture you like to sleep, it depends, is it on back, on side, or on belly? You should choose a pillow and the height of the pillow. If you like to sleep on the back, so you should choose the medium size of the pillow, about 8-10 centimeters. If you like to sleep on the side, the pillow should be higher. It should be more than 10 up to 40 centimeters, because it should support your bend of the neck. And if you like to sleep on the belly, you actually may sleep without pillow, but if it's not okay for you, you should choose soft and small pillow up to 8 centimeters. Regarding to rigidity, it should be hard if you sleep on the side, because it should keep your neck, it should support your neck. If you like to sleep on the belly, you should choose soft pillow, and the size should match to the width of your shoulder. So I hope that this information will help you to relieve your back pain if you have it, and to figure out what to do if you will have in the future. So in this, we finish our lecture, and now we'll have Q&A session. I saw that some of you sent question on the chat. Not, it wasn't a question.
There was a question about advice on how to choose a
I
mattress.
see. Could you please advise on how to choose a mattress? It's more difficult question than regarding how to choose a pillow, because most of the mattresses, they are orthopedic. They just shouldn't be too soft or too hard for you. And of course, if it's allowed, you should lie on the mattress and to feel if it's okay for you, if your spine, if your body doesn't drawn down in it, is it keep your body or not. So just this way, because there are no some rules or recommendation how it should be, how should it fit to you.
All right. Any other questions, Tim? You could either message Maria directly, yeah, if you don't want to make it public, right? Or you could drop it just in our chat. I would love to say thank you. A lot of interesting advice, cool information. You know, I changed my pose while watching this video because
Yeah, as I said on the
of course,
slide, all the listeners change their posture.
because my angle wasn't correct for sure. Yeah, so thank you a lot for this information. I believe that it's really important for us.
Thank you. Thank you. You're welcome.
Thank you.
Okay. Okay, Maria, I actually heard from some doctor that, like, you know, now even some small kids, they have already such a problem, not with back but with neck, just because they always sit in their phones, in their screens. And I mean, we can also extrapolate it to adults. And my question, maybe it's like, yeah, I know that vertebra, it's like a part of it, but like what to do with neck, yeah?
Yeah, a few weeks ago, I saw a picture about posture of future, how it will look, and I saw a person who was like in this way because of often working with cell phone or with some laptops. Actually, it's quite often we have the problem with blood circulation on our neck, and as I said on presentation on lecture, then we have this angle like this. We have less circulation to our head, and we may have some headache. Usually it calls tension headache, and the best work with this massage and improvement of the posture, of course. How to work with with children and with teenagers, I don't know, because they like work with cell phone and with laptop all the day. But we should remind them about the correct posture and to ask them to do some physical activity, to work with muscle here, to do some physical exercises which will increase their force of this muscle, which will improve the circulation, local circulation here. And relaxation we may perform with massages.
Okay, thank you. If no other questions, Tim, then thank you for joining. I shared in the chat the link if you have some feedback to share with us. So please follow the link. And yeah, if there is some topics that you would like to discover in future sessions, maybe in Ukrainian language or in some other language, yeah, feel free to write it there and we will take everything into consideration. But other than that, I hope that it was really useful and a really good reminder for all of us to take care of our back and posture, right? And saying big thanks to Maria. Thank you a lot. It was really interesting.
You're welcome.
Yeah. Thank you very much.
Yeah,
You're
thanks.
welcome.
Thank you.
Have a nice evening.
Have a nice
or
evening.
day.
Bye.
Bye-bye.
Bye-bye.
Let's have a train session.